As we age, it's natural to want to stay on top of our health. But did you know that some routine medical tests might do more harm than good for seniors over 70? In fact, many common tests that are recommended for younger people become unnecessary or even dangerous once we reach our golden years. Shocking, right? We're constantly told that prevention is key, but there are certain medical exams that seniors should avoid at all costs. Yes, you heard that right. While many doctors push for routine screenings, not all of them are beneficial for older adults. Some of these tests might offer false results, cause unnecessary stress, or even lead to harmful treatments that your body can't handle anymore. So, what are the top 5 medical tests that seniors over 70 should refuse? Let's break them down, and I'll explain why these tests are not only outdated, but could actually endanger your health. This is a must-know for every senior who wants to live their best, healthiest life without unnecessary medical interventions. Stay tuned, because you might be surprised by what we uncover. As we get older, it's not uncommon for medical professionals to recommend a variety of tests to monitor our health. However, not all of these tests are suitable for seniors, especially those over the age of 70. Some are outdated, irrelevant, or even potentially harmful due to the aging process and the body's changing needs. Today, we're going to break down the top 5 medical tests that seniors should seriously consider refusing after 70. Colon cancer screenings. These screenings are important, but routine colonoscopies after a certain age may not be necessary. According to several health guidelines, seniors who are in good health and have no symptoms of colon cancer may not need to continue routine colonoscopies after 75. Why? The risks of the procedure, such as perforation of the colon or infection, increase with age. Additionally, the benefits of screening decrease because seniors may not live long enough to benefit from early cancer detection and treatment. Prostate-specific antigen test. This blood test is commonly used for screening for prostate cancer, but it's been widely debated. For men over 70, the PSA test often results in more harm than good. A positive test might lead to unnecessary treatments like surgery or radiation, which can significantly reduce the quality of life and sometimes even cause more harm than the cancer itself. Many doctors suggest that PSA testing is unnecessary for older men who don't have symptoms of prostate issues, as the risks of treatment may outweigh the benefits. Annual physical exams. While a yearly checkup might seem like a smart choice, for seniors over 70, it's often not needed. Routine exams can become repetitive and may lead to unnecessary treatments. Unless you have new or concerning symptoms, skipping the annual physical can save time, money, and avoid tests that may not be relevant to your current health. Instead, a targeted exam that focuses on your specific concerns or any existing health conditions may be more beneficial. Always discuss with your doctor if a routine exam is truly necessary. Routine mammograms. Mammograms are crucial for breast cancer detection, but after the age of 75, the need for routine mammograms becomes questionable. Several studies have shown that the benefits of screening for breast cancer in elderly women are limited, especially for those with a life expectancy of less than 10 years. In many cases, mammograms can lead to overdiagnosis and unnecessary treatments for slow-growing cancers that would never cause harm. After 75, women should have a conversation with their doctor about whether mammograms are still appropriate for their health needs. Bone density test. Bone density tests are essential for detecting osteoporosis in younger women, but after age 70, the routine use of DEXA scans becomes less clear. Many seniors already know they are at risk for fractures or bone loss, and for those with a history of osteoporosis, this test might be beneficial in determining treatment options. However, for healthy seniors without any significant symptoms, this test might not be necessary. The risk of fracture after 70 is already high, and treatment for osteoporosis can often be started without the need for a DEXA scan. Why these tests should be refused after 70? It's important to understand that the needs of an older body are different from those of a younger one. After 70, health risks shift, and what worked in earlier years may no longer be the best approach. Here's why refusing these tests can actually be beneficial.
Reducing the risk of unnecessary treatments. Many of these tests can lead to overdiagnosis or false positives, which then lead to unnecessary treatments. For example, a positive PSA test might prompt aggressive prostate treatments that could have been avoided. Preventing physical harm. Procedures like colonoscopies or mammograms can cause physical harm in seniors with higher risks of complications like perforation, infection, or even anesthesia complications. Quality of life. The side effects and stress caused by unnecessary treatments often outweigh the benefits for seniors, especially for conditions that may never affect them. For example, the anxiety of having an unnecessary mammogram or bone density test can affect a senior's mental and emotional well-being. Cost and time efficiency. As seniors age, it's important to prioritize medical resources that genuinely improve their health. Instead of frequent screenings and tests, seniors should focus on treatments and interventions that directly impact their quality of life. When to get tested. While it's true that many tests should be avoided after 70, some tests are still essential. These include blood pressure checks, cholesterol levels, diabetes testing, vision and hearing exams, vaccinations, and preventive care. These tests and screenings can help you stay healthy and manage chronic conditions without unnecessary interventions. When it comes to health, every senior has the right to make informed choices. While it may seem like we need to do everything to protect our health, it's important to understand that not all medical tests are beneficial as we age. In fact, some may cause more harm than good. After 70, focus on a healthy lifestyle, regular checkups that address your specific health needs, and preventive care. Always consult with your doctor to determine which tests are truly necessary for your situation, and feel empowered to refuse tests that may no longer be appropriate. So, the next time your doctor suggests a routine screening, consider asking whether it's really needed. It could save you time, money, and unnecessary stress while helping you live a healthier, more enjoyable life. Stay informed, stay healthy, and remember, it's never too late to make the best decisions for your well-being.